So first off, I just want to quickly recap what are the different variants that we are seeing. And there's actually, I think, 4 variants worth talking about. There's a lot of talk, of course, about the 3 ones that are new, but there's actually a variant that has been around for a while. And that variant is actually the D614G variant, which we first saw emerge about a year ago in Italy. And that really became the variant of the virus that spread through most of Western Europe, spread throughout North America. There's been a lot of debate around this variant of whether this variant may actually have been more infectious than the original version of the virus, which originated in East Asia. Lots of research suggests that. And if so, that perhaps partly explains why Western Europe and North America have struggled so much more in terms of controlling COVID-19 as compared to countries like China, Japan, Taiwan, Australia, New Zealand, who have that original version of the virus, which doesn't spread as easily. There's some debate around this just because that we haven't seen many places where we have both the original version of virus and that variant basically competing against each other for the same population and seeing how well it travels. We had, Asia had got the original version of the virus. It had basically established itself there. They never really got this new variant. Whereas Western Europe, North America, the first version of the virus to arrive was really the variant. So it had spread through everybody. So it actually had a dominant position and we never really saw the two competing against each other. What we've seen though with the newer variants that are emerging, the B117, which we identified in the UK, the B1351 in South Africa, and the B1 variant in Brazil, is that they emerged in the background of the other versions of the virus, particularly in terms of the UK and Brazil with the D614G variant. And we've seen that, in competition with that D614G variant, these ones are definitely even more transmissible and spread more easily than that D614G. And so measures that control the usual version of COVID-19 that might be around the D614G is not enough to control these other ones. And slowly these other ones start to pick up pace and grow more quickly. And I'm sure everybody saw the modeling that came out last week by the Public Health Agency of Canada. So this is what they were modeling, showing what's happened with COVID. This is the first wave, we have the second wave. And if we take the new variants out of it, basically we're on this great trajectory that we would see cases continue to come down and down and down. Of course, if we reopen too aggressively, we take away the conditions that stop this growth that we saw here, and we'll go back to actually seeing a trajectory similar to what we are seeing with that growth. If we are more cautious about that reopening, we can hopefully level it off at a way where it's more sustained. But that was all assuming that we did not have these new variants coming. If we have the new variants, they showed this graph instead, where this gray line now actually starts to spike very rapidly upwards. And a quick reopening, of course, means that we see that spike more easily. And that to control these variants, we actually need to continue to have enhanced measures in place in society to continue to keep them low. And that's unfortunately the scenario that we are potentially facing here in Canada with those variants starting to establish themselves. Just to give you a view of what this has looked like in other countries where they've had the variant arrive and start to spread more quickly. Just as a reference point, this is what it's looked like in terms of Ontario, in terms of cases per million population. And then we take a look at the UK where the variant first established itself. You can see that they had a second wave starting really in October. They went into a lockdown, which brought it down. They came out of the lockdown, and those variants basically led to a very sharp, quick spike again. And that's because those variants were able to spread even more quickly than the previous version of virus, leading to that kind of spread. We look at the Netherlands, and they have the exact same problem. They saw a sharp spike due to the variant. We see that here with Spain as well, a sharp spike to the variant. And then Ireland, which has the sharpest spike of all from that variant. That's what we need to, of course, try and avoid seeing here in Canada and particularly in Ontario. Now, I just want to quickly show you what's happened in Newfoundland. I think many of you have heard about Newfoundland and the disruption they've had to their previous and provincial election. And this is what their cases have looked like. And they are actually seeing a sharp spike due to the variant. Atlantic Canada, the Atlantic bubble has been much vaunted after they brought their first wave down, and they've really kept it controlled. And we're seeing with Newfoundland the first example where the variant is basically overwhelming what they had in place that has been so successful in controlling COVID-19. And they're now seeing a similar kind of spike that we saw in Western Europe due to the variants. And actually, if I switch from this view, which is looking at an average of cases per day, over to the actual cumulative cases, so adding on how many more cases occur over time, this is the kind of curve that we see here. So, we had the first wave, they flattened the curve, and Newfoundland has kept it pretty flat. And now there's been a spike here. And I think what's significant about the spike is actually, if you look at this point here, this is actually less than halfway to where they are now. So it's actually been really in the last 10 days. Newfoundland has had more cases in the last 10 days than they had in the previous year in terms of COVID-19. And that's how quickly things have grown there. Now, that's of course starting with Newfoundland, which had things extremely well controlled and hasn't had nearly as many cases as we have. So they could double their cases much more quickly than we have. But nonetheless, I think it's a really cautionary tale of how quickly things could change if those variants start to take hold in a serious way here. Looking at Ontario, of course, we are in a state where we are seeing COVID cases come under control, and they've certainly been coming down. Last few days, they've maybe flattened out a little bit. Not sure if that's significant, but I think it is notable that where Ontario is right now with cases is, of course, still well higher than we were back in the first wave and before we started reopening after that first wave. Switching similar to a cumulative view of cases that we had with Newfoundland, this is what it looks like in Ontario, where you have a first wave, it flattens out. We've had the second wave, and we're starting to see that flatten out, but not quite there in terms of having it completely flat yet. So this is what's happening with cases. It's definitely a good sign that things are starting to flatten out here. But when we look at the variants, particularly in the GTA, we can see what the pattern is there for them. And so this here is what it's looking like in York Region. And you can see it's rising, and you're not seeing evidence that it's flattening out the way we are seeing with cases overall. Ditto with Toronto, where it's not flattening out and maybe has even accelerated a bit. Likewise with Peel, it accelerated, it's still rising. You're not seeing that flattening out. And that, I think, speaks to the issue of COVID-19, when it's one of these variants, doesn't come under control as easily with the kind of measures and even the lockdowns that we've had in the province recently. And of course, notably, these are all regions that were in a stay-at-home order until today, where York Region has exited the stay-at-home order, but Toronto and York remain. And despite that stay-at-home order, these were still climbing relatively quickly. Now, these are all in terms of confirmed cases of the variants. And you can see there are around 50 to 65 or so confirmed cases of variants. What the province has been doing since February 3rd is that they have a new screening test that any person who tests positive for COVID-19, that test sample then gets screened to see if it is possibly one of the variants. And then, of course, it's a 2-week process to actually get a confirmed result, such as the ones that we have here. So this is giving us some more real-time or closer to real-time information of what's actually going on with the variants, whereas previously waiting for a confirmed variant case was about a 2-week delay. And so if we're looking here, Toronto, Peel, York, which I just put up, and then the Ontario total, this is how many confirmed variant cases that they've had. But if we look at last week and what the province has put out in terms of screening results for the variants, these are the kind of numbers that we see here. So there's actually a very large number of additional likely variant cases out there that have screened for the variant. We're still waiting for the confirmation, but we can see that some of these regions are going to be doubling to, in the case of Toronto, even tripling the number of variant cases that they have out there. And we haven't been able to detect this because we're still waiting for those cases to go through their confirmation testing. And so that, I think, gives a signal of where things may be headed soon if, these are all cases that get confirmed in the next little while. In terms of, what percentage of cases these are, what percentage of our cases are variant cases, these are the percentages that the province has been seeing. So, looking in the order of 10% of cases are now seeming to be the variants, with a place like York Region where it's actually up to about 17.6%. This is, of course, looking just at the February 12th to 18th period. With Ontario, we actually have the total number for all variants that have screened positive even before February 12th. And that gets us actually to a number that's almost double that number again. So, prior to February 12th, going back as early as February 3rd, and then even into January, there's probably another 500 to 600 variant cases identified on screening by the province. And those, haven't all, of course, gone through the confirmatory testing yet to be confirmed cases of variants. And so, just to graph out what this looks like a little bit, you may remember that on January 20th, the province actually took every single sample of COVID-19 that test positive on January 20th, ran it through the screening, and then actually did the sequencing to identify if they were variants or not. And that was a point prevalence study. It was basically taking a snapshot in time to see how much COVID variant is actually going around on that one day to get a sense of where we were. And that actually came up to around this, about 120, 130 cases of infection at that time were the variant. I then mentioned that more recently, they're now routinely testing every single case with that screening test to find out if there's variants. Don't know what happened between there, but this is kind of, averaging out what that trajectory would have looked like. And now with that regular screening, this is what we're seeing over the course of the last week or so with the variants. And so you can see the total, this is a cumulative number of cases. So, the trajectory is it's adding more daily. And somewhere between January 20th and February 9th, where we start to see these results, there was kind of an inflection point where it started to accelerate. And it looks like we are seeing those variants starting to climb quickly. Looking at the percentage of our overall COVID cases in Ontario, which have been the variant, again, that point prevalence study showed is about 4.4% of cases at that time were the variant. And now what we're looking at is, that number has been increasing, moving towards 10%. And every day it seems to be rising. So a larger proportion of our cases are the variant and a smaller proportion are the regular COVID virus, which of course makes sense because the measures we have in place seem to be controlling the regular COVID variant, but it's not enough, or it's not controlling the variant as much, and the variant percentage is going to continue to rise. And that leads to some of the modeling that the province put out here, where they're showing that the non-variant version of COVID is declining and will hopefully continue to decline, but the variant version of COVID is going to be increasing here. And then the sum of those leads to what we're going to see here, where we see numbers coming down, but at some point it's going to rebound and start to go back up. And then, similar to what the Public Health Agency of Canada was showing, this modeling put out by the Ontario Science Table shows cases of overall are coming down, but as the variants start to become the dominant proportion of our cases, they're going to spread more widely, and we'll see a trajectory where don't know when it's going to be, but at some point those variant cases are going to start to rise very rapidly. And of course, as they rise, we're also going to start to see ICU occupancies start to rise again and put that pressure back on our healthcare system. So that's the scenario we're seeing in Ontario. I just want to also mention here that we now have data on what's happening in Niagara in terms of the variants. So we've not had any confirmed cases of the variants, but we do have screening results showing that there have been in that past week 2 variant cases identified in Niagara on screening. So still waiting for confirmation of whether or not they are, but the screening suggested they were. And a total of 6 overall cases that could be the variant identified in Niagara through the screening ever since the province started to do that. We've done very intense follow-up around these 6 to figure out what's happening. And the information we have right now, the best information is that they actually all link back to the GTA either directly or indirectly. So people traveling between the GTA and Niagara, someone unfortunately got COVID-19 with one of the variants, and maybe a little bit of local spread here, but none of it seems to be unidentified community spread going on in Niagara. So that's certainly reassuring that we are not seeing unidentified spread of the variant here. But as cases of variants increase in the GTA, the risk is that we'll continue to see those cases get seeded into Niagara with travel here, and that's going to be an ongoing concern for us. And so, of course, we want to find a way where we can stop that. And the first line of defense is, of course, we want to be identifying these cases and very quickly following up with them, trying to contain any kind of spread from them, making sure that they're isolated cases, with maybe only a little spread, and it doesn't actually establish itself and spread to the rest of the community. That's what we're doing thus far. Unfortunately, as long as the numbers stay fairly low, we're going to have the capacity that we're able to do that. As we get to a point, though, where there's more spread, of course, that's not going to be enough. And if our source of variant cases is going to be the GTA, we, of course, want to see the GTA get those under control, so there's less risk of those cases showing up here. And this is what was put out by the Ontario Science Table, showing that Toronto, they're looking at right now, has a reproductive number of 0.9. So for every case of COVID-19, there's only 0.9 secondary cases. Over time, if you have fewer than one people get COVID from you, it's going to get smaller and smaller. And that's why we're seeing the declining trend in Toronto as well as the rest of the province. However, with the new variant, they say that the measures that keep the reproductive number to 0.9, with a new variant would only keep it to 1.26. So every case of COVID-19 is going to lead to basically 1.25 additional cases on average. And so hence you get this rising number of cases of the variant as you have the dropping number of the usual COVID-19 variant, and you're eventually going to see a total observed increase of COVID-19. And that's looking at Toronto. If we look at what we would need to get the variants under control, they basically said we need to push the usual reproductive number down to 0.7. If we do that, then for the new variant, it's equivalent to just 1 or just below 1. And that means things could actually come down and actually stay down. And so that needs to really be our goal going forward. Now, when we look at Niagara, where we've been, this is a graph of our reproductive number. You can actually see that we've been below 1 for quite a while. We're actually reporting 0.8 most recently today, but we've been actually in the 0.6, 0.7, 0.8 range bumping around. So we're actually in a good place that if the variant did get out in the community, we're at a level where it wouldn't start to grow exponentially and grow out of control. But we, of course, need to keep it there. And this has, of course, all been achieved while Ontario has been within a provincial shutdown. And so as we are lifting measures, there's the risk that this reproductive number starts to increase. And we're going to be trying to watch that very closely to make sure it doesn't. And that's one of the reasons why I think it's so important we have a slow, careful reopening so we can see what the impact is on that reproductive number and be able to course correct before it's too late. In order to also keep that reproductive number down while we are reopening, we want to try and address some focal additional risks of spread. And so that is, of course, why we issued a couple of Section 22 orders last week. One was a Section 22 order on food premises, similar to the one we did in November, which we found actually reduced the spread of infections amongst patrons visiting food premises. So that's one that we put back in place because we saw good success of it in the fall. And we want to make sure we have that working in our favor again. The other one was a measure for shopping and retail, really to put a bit more onus on them to be enforcing physical distancing in their premises in the lineups outside their store, rather than passively putting a sign up, putting some advice out there that you should respect physical distance, and then really leaving it up to everybody to just follow the honor system and do it. We've certainly seen from our enforcement information and enforcement done by others that physical distancing, crowding does sometimes seem to be a problem in these premises. Hamilton put in place a similar measure back in December. Halton Region has now followed suit based on Hamilton finding it successful, and we're likewise doing the same, hoping that we'll see the same success as them. And so by doing these things, our hope is that we'll keep that reproductive number down below that 0.7 level long enough that we don't see cases rising quickly, or even if we don't quite keep it to 0.7, we'll control this rise of cases enough that we have enough time bought that we can get vaccines into people. And as vaccines get into people, that means that's going to slow the spread of infections. And so just lastly, I just want to touch on the latest in terms of vaccination. The province, of course, has their three-phase approach to vaccination. Phase 1 is the most vulnerable people. That was supposed to start in December. It didn't for parts of the province. For us, unfortunately, is more January when we got vaccine. Starting in April, perhaps it might be a little later for us because we got a later start. The vaccine priority will then shift to others, including older adults, people in other high-risk settings, and essential workers. And then once vaccine is widely available in the fall, it'll be open up to anybody who wants to get vaccination. So this most vulnerable group, of course, is our long-term care home residents and high-risk retirement home residents. At least the first within that vulnerable group is that set of people. And in Niagara, we're reporting this. Of course, we've vaccinated residents in our long-term care homes, both with a first dose and a second dose. And we're actually finishing off the high-risk retirement homes today. So that's excellent news that we're getting past that very initial priority within phase one. And the province has really put out phase one is now going to actually be 3 distinct groups. So the first group, and then the one we're just finishing off right now, is the long-term care home residents and high-risk retirement home residents. So that will be very shortly finished. The next priority, which they've called the intermediate group, is staff and essential caregivers of these long-term care homes and high-risk retirement homes. And Niagara Health is, of course, working on vaccinating them. Highest risk priority healthcare workers and very high priority healthcare workers, as deemed by the province, go into this category as well, and Niagara Health is working on them. ALC are alternate level of care patients. Those are patients who are, treated in a hospital, ready for discharge, but can't go back home. Will need to go to a retirement home or a long-term care home. So as future retirement home and long-term care home residents, they are a priority to be vaccinated. And then northern remote high-risk Indigenous communities are the other priority. And we don't believe that this will apply to us, but we're still seeking some clarification. We believe this is really focused on reserves and other kinds of communities that are of high concentration of Indigenous persons. And then the next priority within this first phase of vaccination the province has put out includes adults over 80 years old of age, other retirement homes and senior-specific congregate settings, other healthcare workers, Indigenous persons, and then chronic home care recipients. Obviously, Niagara Health, as they get through these groups, are going to start to work on the next lower priority of healthcare workers, which are here. We in public health are actually in parallel to Niagara Health's work in this group too, going to actually start work on the other retirement homes and congregate care settings to get them vaccinated. And we're working with our Indigenous community to figure out how best to engage them, with home care agencies to figure out how best to engage home care recipients, and starting to plan for clinics where we can hopefully start to vaccinate the 80 plus in the coming weeks as well. And so this is what vaccination is going to look like probably for the next month to 2 months as we roll out. This will be the sequence of individuals getting vaccinated, and depending on supply and how much vaccine we have, that'll dictate how quickly we get through these groups and are able to then move into the second phase of the provincial vaccination. And of course, this vaccination is really key right now because the faster we get people vaccinated, the more protection we have against those variants before they have a chance to really take off and start to dominate. And so this is an absolute priority for us moving forward. And so with that, I'll turn it over to questions.
Great, thank you, Dr. Hergy. So we're going to go through our list, starting with Grant. So when I say your name, I'll ask you to unmute, and you can ask a question and a follow-up. So Grant, you should be able to unmute now.
Hi, thanks for the briefing, Dr. Hergy. How are you doing today?
I'm doing okay.
By the way, Meredith, that does not count as a question.
I don't know, man. I control the mute button, so maybe it does. Carry on.
I've actually got a number of questions, Dr. Hergy, but just to start with, so our friends over at CKTB this morning are reporting that you said Niagara will likely move into red by next week. But in the context of everything that you've said today, and this appears to be a mirror of the presentation you just gave to regional councilors on Friday, and when you look at the fact that since February the 7th, the number of new cases daily in Niagara has hovered around that high teens to low 20s. There's been some outliers. Today was a little low. One day we had 38, was a little high. But it appears to be fairly consistent. The number of new cases are rising in Niagara every day. And this doesn't count, whether or not the variants are here and have spread beyond these 6 cases that you're currently investigating. Given that we haven't seen a really noticeable big drop in cases since February 7th, is Niagara really in a position to move into the red zone, given that where new cases are every day, just looking at that number, is still higher than it was on average than the worst of the first wave?
Yeah. Very quickly, I'm just going to put up our website here. And I just want to draw everyone's attention to this graph here, which is a 7-day average of new cases per 100,000. And you can see we peaked, we've been coming down, And you don't
Dr.
actually
Hergy,
see any
the
evidence that they,
website isn't up.
it isn't
Still-
showing, okay.
Yeah, it still shows your question slide.
Let me do this share slightly differently. Does that work?
Yep.
Okay, great. So this is our 7-day average of new cases per 100,000. I need to get my little marker back here. We've come up, we're coming down, and you can actually see there's no real, it's maybe the trajectory is softening out in terms of how quickly we're coming down, but it hasn't actually flattened out. So I think we are still on a trajectory where cases are coming down. It's not as sharp, it's a little less obvious because it's a bit more noisy, but we are still seeing when we look at the average number of cases that we are trending downward. So I think there's still some good news there. That being said, I think to your broader point that we are hovering at a reproductive number that is around that 0.7, 0.8. There's definitely great risk as we reopen, if variants start to spread, that this might not be enough to control them. We can hopefully slow them down if we're able to keep our variants at that level, but they are potentially going to start spreading more quickly. I think this is where the province's emergency brake is really key. I've really, recommended to the province that we take it slow. We make sure we reopen slowly and carefully with buffer rooms. So if we did see a spike, there would be time to react and get cases back under control, particularly with using that emergency brake. And I think with that, there is, I think it is reasonable to start to reopen and maybe take another step towards reopening if things continue on the trend. But I absolutely think it is a time of reopening where there's a lot of risk. The province has set out a policy if they are going to want to move towards reopening other regions. And all we can, I think, do is try and guide that in the way that mitigates the risk as much as possible.
Okay. Thank you. Shifting over to vaccines, and I'm interested particularly in group 3. I imagine you're starting group 2 fairly soon now that you're through the high risk retirement homes, or will be as of today. So when it looks to me like group 2, these are populations that you largely can identify. Where the lower risk workers are, where the lower risk homes are that you to be going into next. Group 3, however, when we get to that in a month's time or whatever that is, I know the province has said things like, if you're an 80+ person living at home, you're next in line in this emerging group. You will be contacted about when you can go. Do you have any sense as to how those people will be contacted? If you're somebody who's an older person or has a chronic condition that fits in that group and you don't have a family physician, for instance, who's going to contact you? How will you know when it's your turn to go get your first shot? Because I think a lot of people, as they watch this unfold, are very unclear as to who they need to contact or who will contact them.
Yeah, I think part of the issue here as well is we're still waiting for a provincial registration system to be rolled out so people know how they can actually go to register. When it comes to informing the 80+ group, I think it's going to really be a bit of a mass communication effort. We're going to feed the information down through the different kinds of healthcare providers and agencies who work with elderly populations. I just hope that most people in the 80+ age group do have a family physician, and that family physician will be making some effort to reach out to their patients on their roster and inform them of vaccination. Social services groups that cater towards seniors, again, would be another avenue for doing that. But there'll also be lots of mass media where we're going to be feeding information to you and your colleagues here on the call to hopefully cover in your outlets. We're going to be buying advertising to get that information out. We'll do some social media to the extent that elderly people are on social media, and hopefully family members of them are, and we'll hopefully get that information out with a direction of how they can go about registering so they can start to make sure they get on that list and get their appointments.
Thank you.
Thanks, Grant. Okay, down to Bonnie next. You should be able to unmute.
Hi, can you hear me?
Yep, perfect.
Hi, Dr. Hergy. Thank you for hosting this today.
You're welcome.
Just wondering if we can talk a little bit about the variant or possible variant cases in the region. Can you tell us more about some of the circumstances when it comes to these cases? Are they people that are working in the GTA and then coming home, and just the timeline on testing coming back?
Yeah, the timeline on testing coming back has been somewhat variable. The screening test is done by the provincial lab at Public Health Ontario. And so samples that originally went to Public Health Ontario for testing for COVID, we actually got those screening results back within a day or two. If it went to one of the other labs in the province that's doing testing, it then needs to be forwarded to the Public Health Ontario lab. And we've actually seen a bit more of a delay in getting results from that, up to even a week later that we're getting it. I know the provincial lab is doing a lot of work to try and streamline that, with their goal that they can actually turn around these screens for the variant cases within 24 hours. Not there yet, but I think that's the goal what they're headed for. In terms of more detail on the cases themselves, obviously, given the small numbers and privacy considerations, I'm going to be limited in what I can say here. What we did see in terms of the people who had contact within the GTA, it wasn't necessarily that they were spending full time there, but there were people who had visited, who had been living there temporarily and then had moved to Niagara. Those were sort of the circumstances. And once they're here, it does appear that there was a small amount of additional spread to others within the close social contacts that those people had had. So hopefully that gives you a little bit more context.
And follow up, Bonnie?
Thank you. With Niagara most likely moving into the red zone next week, can you tell us about the sector that you're most worried about when it comes to community spread?
I think I'm not sure I can narrow it down to a single sector of what I'd be worried about community spread. I think the risk of community spread isn't particularly in any single sector. I think we've put in place lots of measures in each sector to try to make it generally more controlled. Where I think the risk is just in people's everyday lives of socializing with their friends, with their extended family and the like. That's where we actually have seen the most spread of infections through the fall, and I suspect that's where it's going to be as well. I think reopening businesses, reopening, restaurants and the like, that'll send a signal to people that we can start to step back from some of our preventive efforts. And that's going to invite people to maybe start to venture out of home more, socialize with others more. And I think that socializing is really what's going to worry me the most in terms of spread of COVID-19, not particularly any kind of business sector.
Okay, thanks, Bonnie. And up next, we have Ludwig, and you should be able to unmute now.
Yes, can you hear me?
Yeah, perfect.
Yeah, thank you, Meredith, for hosting. Thank you, Dr. Hergy. Hope you're both well. I'm interested in hearing, Dr. Hergy, a little more about what was alluded on the regional councillors meeting last week about, it seems like the councillors are interested in perhaps getting reports on what sectors the outbreaks are located in. I know that you said that you're about to make some work on that front. So I was wondering if you could talk a little bit about that. What would be the importance benefit of actually reporting what sectors, what type of workplaces are home to these outbreaks, and also, of course, in respect to the variants and the spread there. Will there be some distinction on basically how the reporting will look like of the variants in regards to outbreaks and the spread? Thank you.
Yeah, interesting questions. We are certainly thinking a lot about where outbreaks are occurring. We've seen that the pattern of those outbreaks has not necessarily always been consistent throughout the pandemic. So, there is some caution about how much we interpret that data. Right now, we're seeing a mix of long-term care home and retirement homes where the outbreaks are fortunately decreasing in number, but we're seeing an increase of outbreaks in workplaces, with particularly actually agricultural workplaces being one area where there's particular number that we've seen in recent weeks. That wasn't the pattern of what we were seeing even a month ago. It wasn't the pattern we're seeing 2 months ago. So one of the things we're trying to be mindful of here is we don't want to put out information that maybe signals some sort of risk when actually things are perhaps evolving very quickly on the ground in terms of what might be happening. I don't know the agricultural sector very well, but I could certainly see that maybe a lot of greenhouses and the like are starting to ramp up now to get prepared for planting stuff once the weather improves in the spring. So maybe a month or two from now, it'll actually be a completely different environment in terms of what we're seeing. So, I think there's value perhaps if we start to see consistent patterns of where outbreaks are occurring, that's something that we want to start to report more frequently on. Right now, we have a breakdown in terms of our long-term care homes, retirement homes, other congregate settings, hospitals, and community locations. And we haven't broken down the community locations further just because we haven't seen a consistency of pattern there. But that's something that we'll think about as we start to see consistency of patterns.
And a follow-up, Ludwig?
Yes, thank you for that, Dr. Hergy. So in regards to the variant and the recent modeling combined with perhaps the lessons from Newfoundland and the way things have been developing there, I believe that was the example you gave before. What is likely? I mean, I understand it's a bit of a crystal ball to try and look into and figure out, but what is likely in terms of daily cases should the variants take hold here in Niagara? Like if you're able to, when you look at those provincial numbers and that very sharp curve that the province has laid out, if you could sort of try to translate this into Niagara speak for us and what that could mean actually on the ground, what is likely based on the R numbers, etc. Thanks.
Yeah, what I would say is that, if you're looking at the Ontario modeling here, if the province was peaking at close to 4,000 cases, in Niagara, we peaked actually a little over 200 cases a day. So if we start to peak, we could get back to 200 cases a day. We could keep going up and up and up if things aren't done to actually bring those under control when that happens. So, absolutely, there could be very sharp increases in cases, similar to what we are seeing at the worst in January or even higher. It will all depend on how quickly we respond to signals that cases are increasing, and if the province is really willing to bring back lockdowns if that starts to happen. I think there's an opportunity here, though, that if we're careful, cautious, and slow about reopening, that we can, we first bring cases down to a very low level, have some buffer room, and then very slowly reopen. We can hopefully open up in a way where we don't see variants starting to spread very quickly because there's enough measures in place to contain them. If we are seeing them starting to pick up, we're able to respond quickly before we start to see the kinds of numbers that we're seeing at the peak in January. But I think that's all about being very cautious about how we proceed going forward.
Okay, thanks, Ludwig. And over to Paul Forsyth now. Should be able to unmute, Paul.
Well, thanks, Meredith and Dr. Hergy. So is it your fear, doctor, that if we move to red or even orange too quickly, could that act as a magnet for people from the GTA to come to Niagara and spread the variant more quickly? Is that a likely scenario you see happening?
That is absolutely the worry. We saw in the fall through data we have on mobile devices to kind of track who is visiting Niagara, and particularly our tourist sites, our shopping centers. It definitely was people from the GTA coming down here. And as the GTA started to close up increasingly in November, we actually did see an uptake of people from the GTA coming down to do their shopping here, where stores remained open where they may not have in the GTA and all parts of the GTA. So absolutely, that's the concern. We don't want to be too out of step with where the GTA is in terms of reopening and create greater incentives for more people to come down here.
I think if I could do a follow-up, and I guess the message you're trying to get out is don't have a false sense of security that people are seeing numbers come down. You look at the graphs, they're coming way down, but even at 0.7, that translates with the variance into at least one or more. So we have to not get a false sense of security, I guess, right?
No, 100%. We can't get a false sense of security. And I think this graph is really notable here. You're seeing overall cases come down because most of our cases are the non-variants, but the variants underneath that are starting to increase and it's being lost in the overall pattern. And if that continues, at some point, those variants will actually start to take over and shift that pattern upwards. And, it's easy for people to look every day, see the cases come down. It looks all positive, but that's hiding the fact of what's happening with those variants underneath. Now, the fortunate part is we haven't yet detected community spread of the variant. So perhaps it's not happening here in Niagara. Perhaps we're not seeing that upward trend, but that upward trend is, I think, occurring in the GTA, and at any time it could start here in Niagara, and we need to be very careful.
Okay, thanks, Paul. Richard, is that you logged in as Niagara now? I'm going to unmute. It should be you, Richard, right?
Yeah, that's me.
Okay.
I think most of my questions have been covered here, but just with the vaccine, how effective is the vaccine on these new variants? And is that another concern that we need to be worrying about?
I think we do need to be concerned about what the effectiveness of the vaccine will be. The data that Pfizer and Moderna have put out is that it does seem to still be very effective against the new variants, but possibly not as effective. So there is a little bit less. We're fortunate that both with Pfizer and Moderna vaccine are extremely effective. We're talking 95% of the time they're preventing infection. So, we have some room where if they're not as good, they're still going to provide really, really good protection. And what both, at least Moderna has said, and I think Pfizer may as well, is that they're now actually going to work on booster shots to actually give even better coverage against those variants. So we may actually down the road get a booster shot that gives us better protection for the variants as a third shot of those vaccines.
Okay, thank you. That's great.
And do you have a follow-up, Richard, or no?
No, that's good.
Okay, great. And finally, we will turn it over to Jason from CHCA. So I'll unmute you.
Hi, can everyone hear me?
Yeah.
Perfect. Good afternoon, everybody. Dr. Hirji, good afternoon.
Hello.
I just got one question. I know you mentioned about the emergency break that the province has, but you haven't been shy to add in certain orders, certain restrictions. If we do get to a red or even an orange, are there any other I don't want to say minor restrictions, but are there any other specific restrictions that you have in mind that you may be prepared to install? And if so, what are they?
At this point in time, we don't have any additional measures. The ones that we did announce last week were actually in part in anticipation that we will be moving to red in the near future. Obviously, the restrictions on dining really will have the most impact once we move back to in-person dining, where some limited amount is allowed in red and much more will be actually allowed in orange. So we thought about what would be necessary, and I've put that in place for now. Going forward, it's really going to be continuing to watch what are the patterns that we're seeing in terms of infection spreading, and do we see additional opportunities where we could do something targeted that would reduce further spread. Don't know what those will be. Those will be dictated by the data we see going forward.
Okay. Yep, that's it for me. Thank you.
Okay, thanks, Jason. So we do have a few more minutes for a lightning round if anyone else has a question. So Grant, oh, surprise, surprise, you can unmute.
Okay, thank you, Meredith.
For one question.
For one question.
Yep.
And I'll even make it short. It won't even have a long preamble this time, Dr. Hirji.
Appreciate it.
So really quickly, you've talked about how we need to have a slow and measured careful reopening. We've talked about the data. I mean, it seems fairly evident you're not enthusiastic about moving to the red zone. So my question is staying in gray, would that be your recommendation? And are you, when you talk about the data and talk about what we need to do to try to keep the infection rate down and the reproductive number low, are you just resigned to the fact that the province will move us into the red zone as opposed to it being your recommendation?
What my recommendation to the province really would be is that we are seeing variants in the Southern Ontario, particularly the Golden Horseshoe and around. Definitely the most are in the GTA. We've seen a lot in Simcoe Muskoka, but Waterloo, Halton region, Hamilton's and around's a confirmed variant case. Haldimand, Norfolk has a confirmed case. Middlesex, London, I think is 4. There's variants going around here. Let's make sure we have all of this really under control and actually just keep the entire area under lockdown for now until we actually have those well controlled and we have the safety of reopening. The province has, of course, chosen a different policy that they want to take. They want to be a bit more aggressive about reopening. And so my recommendation is really built around within that framework. I think Niagara needs to take it slow because we, first of all, hadn't come down as quickly in terms of our cases as some other regions. We saw how quickly things spiraled out of control in late December and early January. And I think that's just a function that we don't have a lot of reserve capacity for our healthcare sector, as well as even within public health to do that contact tracing. We're still seeing lots of outbreaks. I want to see fewer outbreaks. So I have people freed up who can do really intense contact tracing with variant cases if they arise. And so within the context of the province reopening, yeah, my recommendation is to take it slowly. I advise that we didn't want to move too quickly out of the stay-at-home order, so we only moved into gray. Whether or not that was based on me or other factors, I'm not sure. And likewise, I would caution moving too quickly into a lower level of the framework at this point.
Okay, Bonnie, do you have another question?
I do. Dr. Hirji, have you heard if the province has started any testing within our schools in the region?
I haven't heard if they've started testing within the schools, no. I've heard the Ministry of Education does have the intention to be doing regular asymptomatic testing in schools. That's not an initiative, though, that we in public health are part of.
Okay, thanks, Bonnie. Ludwig, do you have another question?
Yes, I might just not have had enough coffee yet to have fully comprehended what exactly the status of the variant cases are here in Niagara. So could you just walk me through that quickly one more time? I picked up that you have 6 cases that you believe presumably are variants. So could you just give me that one again? What needs to happen for you to know whether the variant is here, and what variant was it that you presumed might be present from those GTA travelers?
Yeah, so we don't know which variant it is. That will depend on the confirmatory testing that needs to be done. That actually will distinguish if it's the B117 from the UK or the B1351 from South Africa, etc. So we don't have any information on that. All we know is that there have been 6 people who have screened that they may have one of the variants, and we're still waiting for that further testing. We did some very intense follow-up on these individuals because we're very concerned about variants establishing themselves here. And what we found out is that with each of those, they were a chain of transmission that links back to the GTA. And so we believe they were all seeded by travel between Niagara and the GTA. I hope that answers your question.
Okay, Paul, do you have another question?
Paul is muted.
I'll ask him to unmute again. There we go.
Dr. Hurd, can you hear me?
Yes, now I hear you.
I think one reason we ended up stuck in gray was the fact we had a very high death rate in Niagara. Now that we've made a lot of headway vaccinating at long-term care homes and high-risk retirement homes, is it your hope that when the 3rd wave comes, when the variants really get here, we might see a less death rate than what we went through in that 2nd wave?
It's first off my hope that we will not see a 3rd wave here, that we will actually avoid it, and we're hopefully past the worst of the pandemic. Absolutely, I think that having had more vaccine given to people, that is going to give us the likelihood that we'll see fewer deaths from COVID-19. In Niagara, deaths have been overwhelmingly in our long-term care homes and retirement homes. But I'm just going to put up this graph here, which shows what's actually been the case provincially. And what we can see provincially is that about half of deaths have been in long-term care home residents, but half have actually been outside of those long-term care homes. There's actually, in other parts of the province, a lot more older people out in the community passing away from COVID-19. We've fortunately not seen the deaths and perhaps less of the infection spreading amongst our older population not living in those institutional settings. But one of my worries is that if there were a 3rd wave, even if we didn't see the spread of infection and the deaths within long-term care homes and retirement homes, there's always the risk that this might be the time that infection actually does get into our elderly population out in the community, and we might actually start to see more deaths amongst that population, which fortunately we avoid in the 1st and 2nd waves. And so, again, if starting to vaccinate that 80+ group, deals with that black part of this bar, moving down that age categories, will increasingly deal with other persons at risk of dying. The more vaccines we can get out there, the more of the elderly people we can have vaccinated, the less chance we're going to see people passing away.
Thanks, Paul. And Richard, do you have another question?
Yeah. You mentioned that the region was getting some information about travelers and where they're coming from. Are you getting that information from Bell? Where are you getting that information? And is there any way that you can send some of that information to us media guys?
So what we have done is we actually have done what a lot of private sector companies do, which is they buy basically market research data, some of which is based on tracking mobile phones. and they use that, of course, to understand who are their customer base and then sell it to them. We are buying that same market research data, which includes some mobile device data. And our purpose is not so much to sell to people, but to understand who are the people who are traveling around, who are the people who are venturing outside of the home, because that's the group we need to sell on the message about the importance of staying home and practicing the precautions that limit the spread of COVID-19. So we're buying them basically as a private sector package. I don't know if I necessarily want to say the vendor that we've used and favor one vendor over the others, because I think there's a few out there, but basically what these vendors do is they're aggregating the data from all the different carriers, anonymizing it, going through some mathematical processing, and then basically selling it to different companies, including ourselves, with it anonymized, so that we can have some sense of the patterns of what's happening with people. Hope that helps.
Yeah, that's helpful. Do you have any like a number figure of how many people are traveling down, and would it be possible to get those numbers sent over, especially with how many people were actually traveling during the lockdown, since I'm assuming that data would be in there?
Yeah, I don't have those numbers offhand, and I think we would be very cautious about sharing those numbers. We buy this data as basically internal use. The companies that are selling it probably don't want it to be spread out and wide because they're actually charging customers for it. So I don't think there'll be much we could share on that front.
Okay, thank you.
Okay, great. Thank you everyone for joining us today. We've kept you to just under an hour, so 55 minutes. As I said, we'll be doing these weekly now, same time for the foreseeable future anyway, 12:45 to 1:45. If you think of any questions after the fact, please email Courtney or me and we'll do our best to get you an answer. As I said, this was recorded. It'll be posted to our website along with some meeting notes. So thanks again, and we'll see you next week.